Ventral hernia is any hernia in your abdomen, so a gap between muscles where other structures may pouch out, and that can lead to obstructions or pain, and that is usually what brings a patient to seek care for the hernia to have that covered. Anybody can get it. People who have had a surgical procedure before, who've had an incision, are at higher risk. People who have lung disease, are obese, or on immunosuppression have higher risk of getting a hernia. But lots of people get, about 1 in 5 who has an operation probably has a hernia afterwards, so it's rather frequent, unfortunately. We looked at how the quality of life is affected after surgery for hernia repair. Laparoscopic hernia repair is an outpatient surgery. Most patients expect that they go home and feel well, similar to a laparoscopic gallbladder surgery. However, we know that that may not be quite the case because some pain may be different or they may feel more tired. So in our study, we looked at how the postoperative quality of life changed for patients, if it changed at all, and when it changed, and if it was different between people who were older, younger, or men and women. And we found that the quality of life overall remained relatively stable for the entire group, but women seemed to have a harder time with the surgery. Their quality of life actually went down more than men, and people who were younger also had a bigger impact than people who were older. They seemed to be more stable. Quality of life is a composite score that has physical, emotional, mental, and social domains. And sometimes it is the pain or the physical well-being. Sometimes it's just feeling very tired. Sometimes it's you can't go out with your friends because you're not feeling like it. Then it's the social well-being that's not so good. And we found that mainly the physical well-being, the pain, and fatigue were the scores that contributed to the quality of life overall. It's worse than expected for the patients probably, and our study describes when and how it is worse and which patients are more likely to feel it's worse for them than for others. So I think it's important for the patients to understand that expectation ahead of time so they're not surprised and disappointed. And then, of course, for the physicians, it's important to look what can we do to improve that. Is it the pain control? Is it other adjunct help that we can provide to get through the pain or through the fatigue for the time after surgery. Also to set limits to know how long can I expect that will happen, when do I expect that gets better. That's very important for patients.